Thank you. And finally, Luke Evans.
An even broader question for you, Sir Simon. This is a big change that you've put forward on the White Paper. What's the biggest surprise you've had with regards to the reaction to the White Paper?
I don't think there has been a surprise, to tell the truth, Luke, because I think we've been working so closely for a number of years now with colleagues across the health service and our broader partners. So genuinely, I think this is unusual, if not unique, in terms of having sort of come from the NHS as a series of asks to Parliament, rather than something that Parliament perhaps is imposing on the NHS. I mean, look, the reality is we obviously, as the NHS, work very closely with our partners. We work very closely with ministers. I mean, right through this pandemic. You know, the idea that this is some new notion that there should be ministerial accountability in the NHS. I mean, the fact is that, I was thinking back to this time last year. We were a fortnight off from the March 23rd lockdown. This week, the March, whatever it was, 10th, 11th, 12th, 16th, we were having detailed discussions with very senior ministers about what the NHS response should be, how to free up capacity to look after the extra patients, the patient discharges, the elective care. All of those were decisions agreed with ministers. So the idea that this is, sort of operating distinct, I think, is not actually the practice of the matter. But my final thought, I suppose, would be I would commend to the committee, to the extent you are so inclined to back us on this, I would commend to the committee Aneurin Bevan's dictum when he said, and if you'll forgive me, Chair, he said, quote, legislation in this country starts off by voluntary effort, by empirical experiment, by improvisation. It then establishes itself by merit, and ultimately, at some stage, the state steps in, makes what was started by voluntary action and experiment a universal service. That is the experimentation that the health service, the evolution we've been on over the last 7 years. Now we are asking you to step in and make it universal.